A difference a little nip or tuck might make. From eyelid surgery to chin augmentation, I don't even know what that is, to rhinoplasty.
Let's not talk about your weekend.
Well, fine. Changing your appearance through plastic surgery is becoming more and more mainstream, and I'm going to add, people are younger and younger.
They are, with celebrities like Kris Jenner and Cardi B sharing the details of their plastic surgeries. More and more folks are going under the knife to make themselves look and feel better.
Joining us to tell us about the 2025 plastic surgery trends is board-certified plastic surgeon Dr. Smita Ramanadham. Very good to see you.
Hello, good to see you. Hello.
I want to preface this by just saying, we are just throwing out there the trends. We are not endorsing, we are not saying you need to a little nip or tuck, you need to do this, that, or the other. I myself, sometimes at night before I go to bed, I look and I'm like, what did Cardi B have done to herself? That doesn't mean I'm going to do it, but you know what? Sometimes I'm voyeuristic.
But more and more people are getting plastic surgery. And why do you think that is? Why are more and more people getting plastic surgery?
Yeah, you know, I think with plastic surgery, first of all, our society, we're just so focused now, which is great, on wellness and self-care. And that's sort of an extension of that, right? I think also with social media and celebrities and just normal everyday people being vocal about their own experiences sort of decreases some of that negative stigma that we used to associate with plastic surgery.
Yeah, well, and speaking of that stigma, do you think that stigma still exists? Do you think it's going to go away as more people have surgery?
Yeah, you know, I think we've come a long way, and I think a lot of it is gone, but we're still working on it. There's still that sort of fear that you're naive and things like that if you get plastic surgery done. It's still out there.
Well, let's get into some of the things that are out there that have been in the news, that have made the headlines. Ozempic overhauls.
Yes.
Are we that falls into the Venn diagram of plastic surgery?
Sort of the results of that, right?
Okay.
So a lot more people are on these weight loss medications, the GLP-1 medications, and with that we're seeing larger weight loss. And that comes with loose skin. So a lot of arm lifts, body contouring procedures where we're sort of addressing loose skin, excess skin, hanging skin. So we're definitely seeing a rise in that.
Everybody in the studio right now is looking at their arms and they're pinching themselves and looking for the ballet bodies. Are back. It's a trend right now. Can you explain to everybody what that is and what that means in terms of plastic surgery?
I think that's, you know, in general, that's a smaller, more athletic sort of body. You know, and so I think in the past, everything was bigger. It was, you know, the bigger breast implants, the bigger Brazilian butt lifts. And now we're seeing more of that natural, sort of smaller changes that you're just doing it for you. We're active. You know, a lot of people are, again, focusing on wellness, self-care. They're working out, running. And so you want your body to fit that lifestyle.
Yeah.
Here, as my 15-year-old says to me, Mommy, you're not thick, you're mini thick. And I said, should I take that as a compliment? And he said, yes.
I wouldn't even know what to call that.
I don't even know what it is either, but he said it's a good thing, so I'm running with it.
Roll with it.
All right. The next trend is deflated fluff.
Yeah, so
what is this?
So that essentially means it's the filler trend, right? I think, you know, you walk down the street, you look on TV, a lot of people are overfilled. Yeah. It looks unnatural, and we're shying away from that, you know? I think a lot of people, at least in my practice, are coming in, getting their fillers dissolved, because you can overdo it, right? And that's not the look we want. A filler should be used to just augment, highlight, refresh you, and nobody should ever know that you've had that done.
Right.
Yeah, what about neck nips? Little trim.
Yeah.
I like alliteration. Work with me here.
Yeah. I think this trend started during COVID and Zoom.
Right, because everyone looked like they had a double chin when we were looking down at our monitors.
Exactly. And I think, you know, that's continuing, right? And we can do so much more with the neck. There's obviously the neck lift, which is the surgical procedure. But, you know, we can do Botox, fillers, skin resurfacing to really just improve the overall quality of the skin in that area.
Okay. The next thing I think I like, because he sits next to me, when I put on my makeup, I'm in the 10 times magnifier, and I'm just like, oh, and he knows I'm putting on my concealer. Eye erasing. Yeah. Talk to us about this.
Yeah, it's a similar concept to the neck, right? Our skin around our eyes is extremely thin. We definitely, you know, don't maybe take care of it as often as we would our facial skin. And so we see a lot of the aging, the fine lines, the puffiness, and it makes us look tired. And so, again, you know, there's eyelid surgery, but we can do little things like Botox fillers, skincare, lasers, things along those lines too.
I've heard of the trend of medical manipulation. What does that mean?
So it's regenerative medicine. So we're using a lot of, PRP, exosome therapy to really improve the quality of our skin. So it helps with the anti-aging. It helps with healing of the skin. And so it promotes, it improves inflammation. So we can really do a lot with these treatments that are all non-surgical.
Okay.
Ooh, interesting. I feel like plastic surgery is a little like bagpipes, which is when it's good, it's great. And when it's not, it's not. Right?
Yes.
So play your bagpipes properly, please.
You heard it here first. Thank you so much.
Thank you very much for having me.
It is always wonderful to see you. And thank you for telling us about the options. Because at the end of the day,
it's all about making sure you have the options.
Follow Dr. Smita at the Dr. Smita on Instagram.